Ahead of the curve at Golden Vision Clinic.
We at Golden Vision Clinic are leading the way to the standard of care for 2025.
Why is this important to you, our patient?
These technologies and tests take us to new levels of care beyond just prescribing your latest glasses prescription.
We can see things we cannot see otherwise, like looking at a glass of water, then putting it under a microscope. Could not see any other way. The ophthalmoscope was invented 150 years ago, which is an instrument to see inside your eye. Note the candle. This is a view with a 150-year-old ophthalmoscope. Look through the transparency and see what may not be seen.
Microscopic view. These are examples of views from other current technologies.
Notice this 45-degree photograph. Look through the transparency and see what may not be seen.
– 110-degree photograph.
And now a view with the 200-degree imaging. This is the state of today's technology and what we use, expanded even further with steering as needed. With the eye imaging 200 plus. Now ultra-wide imaging of the inside of an eye.
We have had this level of technology since 2015.
We go one step further when needed, called steering. We extend that image by having 4 additional images to capture more and more of your retina. To see hemorrhages from diabetes, retinal holes and tears, and retinal detachments, otherwise may not easily be seen. These are the 5 images to expand our view of the inside of your eye. Expanding the view by having the patient look up, down, right, and left. Tomorrow, they will be blended together as we can do in Photoshop. Some of the many events that can be found. Notice the retinal detachment. Some patients are aware of this vision-threatening event, others are not. As well as the choroidal nevus. Is that a malignant tumor or not? This important imaging will help that diagnosis. Notice the image of the horseshoe tear. Will that lead to a giant retinal detachment and lose all vision? As well as the floater. Is that a retinal detachment or not? Cotton wool spots are a sign of high blood pressure in the eye and in the rest of one's body. Is this retinal hemorrhage caused from an undiagnosed diabetes? Melanoma cancer can occur in the eye and can be life-threatening. Normal 70-year-old retina. 6 months later, calls with flashes and floaters. Is that a retinal detachment? Luckily, it was only a floater without a retinal detachment. Baselines are important.
Baselines or images or data that we can compare over time. So if something is normal today or in the past, we can assure that was not there before, or we can see how much something has progressed.
Diabetic microaneurysms. The diagnosis of diabetes many times is initially made by your optometrist from these types of images or many other signs or symptoms. Microaneurysms are small bleeds from uncontrolled diabetes, which can lead to blindness. Your physician will send you to us to have your eyes examined. A report and your images will be sent back to them. Then came scanning imaging of the inside of an eye, 27,000 scans a second.
In 2013, we introduced scanning imaging of the inside of an eye.
Our imaging system is 100 times the resolution of a CAT scan or MRI. Seeing layers of your retina cannot be seen any other way. sees and identifies things never before visible, helps determine if your eyes are really healthy or not, and can guide us to help you prevent blindness. This is an image of a normal macula, the normal depression in the macula.
This is the very small macula and center of your vision. It is a 1/4 inch thick in size. This is what you read with, see faces with, and drive with.
This is an image of an epiretinal membrane. Note the irregular surface. This is an image of macular edema. Macular degeneration. Vitreous traction. This can lead to a macular hole and loss of vision. With these technologies, we can see these conditions better and earlier. This test measures your side or peripheral vision. Why is this important to you? It screens for retinal detachments, strokes, head injuries, glaucoma, and brain tumors. This is a visual field screening to test your peripheral vision. This is a test included in your comprehensive eye examination. This is a life-threatening pituitary tumor, not previously diagnosed or treated. This patient had brain surgery and survived. With our newest testing that most offices don't care to invest in, the real values show easily. This is another test included in your comprehensive eye examination. This is the latest and most accurate instrument to measure your eye pressure for glaucoma. It not only measures your eye pressure, but takes into account corneal thickness and corneal strength that influence the real pressure. Note the earlier red high eye pressures for glaucoma with prior tonometers. During a glaucoma evaluation with one of our imaging systems, we found a very thick cornea, which artificially makes the pressure appear falsely higher. Macular pigment. This is a very important new test that is included in your comprehensive eye examination. We believe it has great preventative potential for macular degeneration. Below 50 units is a risk for developing macular degeneration. This can be improved with correct macular vitamins. The results of this macular pigment density test reveal how dense that pigment is, like internal sunglasses to protect your macula and central vision. Corneal cell count. We are fortunate to be one of the offices or clinics that has this technology. This instrumentation enables us to see and know this detail of your cornea. Notice the healthy layer on the left, and as we move to the right, the tissue gets more and more sick. We use this test for 3 important reasons: to assure there is not contact lens abuse or damage prior to cataract surgery, and to help diagnose corneal diseases. This is an image of an unhealthy cornea. This amazing technology allows the doctor to see details of your eye that were not visible before. These cells do not reproduce. This test can determine the aging of this tissue and be helpful to guide contact lens patients to be compliant. Some patients are at more risk than others. Cataract surgery is primarily done through the cornea. If your cornea is sick, this may make it worse, so we work with our surgeon to not enter through the cornea to prevent this problem. Could not see any other way. We do not care for your eyes by minimum standards, yesterday's instruments, or insurance minimum tests. This image shows the evolution of imaging inside of your eyes. This is the view of the instrumentation from 1950. We embraced this technology of the iImage 200 Plus in 2015.
Tomorrow, in 2025, this will be the standard of care. Retinal imaging was not available in 1950. This imaging was invented in 1995.
We are leading the way now with our knowledge and instrumentation.
This will become the standard of care in 2025. This image shows the evolution of imaging inside of your eyes.
We at Golden Vision Clinic are leading the way to the standard of care for 2025. Available to you today at Golden Vision Clinic. We appreciate you, our patients, and thanks for being here from your team at Golden Vision Clinic. Ahead of the curve at Golden Vision Clinic.